Hi, welcome again to Pharma World and to this Pharmacokinetics tutorial. I believe that this series of tutorials help you to understand the topics clearly and have a firm pharmacokinetic base. This is the fifth part of the tutorial, and you can set the basics of absorption, distribution, metabolism, and excretions in the earlier part of the series for a better understanding. Let's start. There are a lot to know in the world of pharmacokinetics. Today we will discuss on the effect of bolus intravenous dose and its associated pharmacokinetics parameters. So basically what you see generally in various diagrams of PK, be it in book or in the internet, is so speaks about the PK associated with an IV dosing. This is because it is easy to understand. So let's start with the one compartment model and try to get a good grasp on the IV dosing and its various effects on the PK parameters in both one compartment as well as two compartment model. So what we can see here is that there is a concentration as well as a plotted against the time. So concentration here of a drug that is at 2 hours, 4 hours, 8 hours, 14 hours, and 24 hours. And you can see that as the time goes, the concentration of the drug decreases with the time. So obtain the volume of distributions in this case. Uh, you have to use the form, you know the formula that is V equal to D divided by the concentration. However, as I mentioned, the concentration is continually changing. So in that case, what exactly we need to take? The concentration that we need to consider is that immediately after dosing, that is C naught. C naught that is at the point of 0 hours. Okay. So it is only at this time point that the entire dose is actually present in the patient. Hence, the practical working formula is V is equal to D divided by C naught. So the next question is that is it possible to measure the drug concentration at time point 0 hour? For example, if I give 6 milligram IV to a patient, so whether I can measure the concentration at that time point? Seems impossible now. Yes, but we can calculate it through different ways. Let us try to understand both of them. The first one is pretty simple. The concentration at time point 0 can be estimated with the help of a log graph. So what you can see here in this uh, video is that semi-log paper. Okay, so if you have the concentration of a drug at other end points like time interval. So this is the time interval. Okay, so if you have three concentration at least of the drug at any time interval, then what we can do is that we can extrapolate the this curve to the time point 0. So if you do that, so suppose it cut the that is y-axis. So in the y-axis at which this lines cut, it gives you the theoretical C naught. Okay, this is how generally we can find the C naught. Next thing, with the help of formula, with the help of maths. So for example, suppose we have a patient who has received 500 milligram of drug. So we have two time points here at 2 hours and 9 hours. We measure the concentration for that 10 milligram per liter and 2 milligram per liter. So here we have two time points. Okay, and for the graph, generally we need to have at least like three time point. So that is one of the advantages. So with this mathematical formula. So first of all, what we will do is that we will try to figure out the elimination rate constant. There is a formula for that this. So we put the numbers in this formula, and in step 2 we just try to figure out the C naught. So if we follow step by step, we can find the concentration of the drug at time 0. So that is the basics of one compartment model. Now just try to understand how it behaves in two compartment model. We can see here two lines. The blue lines indicates one compartment and the red line indicates the two compartment. Blue line is an ideal thing to achieve, generally for the drugs which have a very low volume of distribution. Generally, it is not a straight line, and there will be some blend unless you transform into a log graph. The band that we can see here in the red line, because of various reasons, just let us try to understand step by step. So dark blue is the first compartment, and here is the two, that is, this is the other second compartment. Okay, so this is the point where we give the drug, so IV drug. So what happens at this point is that drug elimination will be also occurring side by side. So at this early time, there are two processes: redistributions and elimination. Okay, the drug is really eliminated at this point, as well as there will be redistribution occurring towards the various other tissues. So both of these simultaneously will be removing the drug from the first compartment. Consequently, what you can see is that a very fast fall in the concentration of the drug in this compartment. You can see this fast fall, okay, and we see a rapid drop in the blood concentration at this early stage. So by this time, the concentration in compartment 1 will have fallen, and in case of 2, the concentration will have risen. So, and there will be moment of equilibrium. Drug will be moving in both the directions, but there will be no net movement. So you can see there's two arrows here. You can see the drug will move from 1 to 2 and 2 from 1. So we now have this one process, that is elimination, and that's why there is further fall in the concentration of the drug in the first compartment, and I can see, you can say that the graph now falls more gently as compared to from here to here. Now at time point C, what happened is that there will be continuing drug eliminations from the first compartment, and it causes new disequilibrium. So the drug will move from first compartment and it will be eliminated. Side by side, there will be movement of drug from the peripheral compartment to the first compartment. So we now have two processes affecting the amount of drug in compartment 1. That is elimination from this compartment, but re-equilibration is moving drug back in. That's why the rate of decline of concentration in compartment 1 is therefore very slow at this late stage. So here at the very beginning, that is in the A, there will be first drop, then there will be a gentle drop in at time point B, and in the time point C, there is a very slow drop in the concentration of the first compartment. So till now, we have spoken about the concentration of drug in the first compartment. Okay, that is this is the line. The black line indicates the concentration of the drug in the first compartment. Side by side, if we try to concentrate of the concentration of the drug in the second compartment, so it rises. Where in the case of first compartment it falls, but in case of the second compartment it rises because there is movement of the drug from first compartment to the peripheral tissue. So it rises, attains an equilibrium, and then again it falls back. So this is how the concentration of drugs will be if we measure it in both the first compartment and the second compartment. So let us try to understand what is the clinical relevance of first and the second compartment. So you might be aware of therapeutic drug monitoring, which is known as TDM. So it is the process in which blood samples are taken from patients to determine concentration of drugs for which the levels have to be controlled with specific ranges. Okay. Digoxin that is being given in case of arrhythmia. Previously, now this it is being less given. So it generally acts on the cardiac muscle, and this is within the second compartment. Okay. There is no direct link between the blood levels part of the first compartment and the therapeutic effect of digoxin. So it is the amount of drug that is in the second compartment that is more important. So the concentration in the second compartment that will be directly linked to the outcome. So whatever the concentration in the first compartment, it has have less significance. So for that, the blood samples for TDM of digoxins are normally taken at least 6 hours post dosing. So the initial 6 hours, generally the drug will be staying in the first compartment. If we calculate the concentration of this digoxin in the first compartment within the first 6 hours, it has less clinical values. But at the time point that is around 6 hours, it is in the equilibrium between the first and the second compartment, and that is the point where we should take the blood concentration, and therefore the dose of digoxin can be manipulated based on the result. So these are my references for the today's presentations. Please like and share and subscribe my channel if you like these presentations. Thank you.